Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute here in downtown Chicago. And on today's episode, we are going to answer the question, what is tinnitus and how do we treat it? And tinnitus is a clinical term for ringing in the ear. And ringing in the ear could be a high-pitched sound, a low-pitched sound. It can happen with dizziness. It can occur spontaneously. It can happen after a concussion or head injury. It can happen with stress or anxiety. And it can happen a lot with hearing loss as well. That happens maybe throughout life or as we get a little bit older. We start getting hearing loss, and that hearing loss then leads to tinnitus, or this ringing in the ears, this abnormal sensation, or basically a sensation of hearing a noise that is no longer hearing a noise that is not there or not present. And so I want to talk about what is the cause of tinnitus, the few different areas in the brain that can cause it, and then what we do to treat it. And there's just one paper I want to talk about that has some good clinical reviews of studies that have shown to help with tinnitus, but then other ways that we can do it as well. So let's get right into the paper. And we'll start with just the abstract. So this paper is from Neuroplasticity in 2016. It is called Electrical Stimulation of the Ear, Head, Cranial Nerve, or Cortex for the Treatment of Tinnitus. And so it's all about electrical stimulation for tinnitus. And so I want to start with just the abstract because this is just paints a really good picture of what it is and what then we have to do for the brain to activate parts of the brain in order to fix it. So tinnitus is defined as a perception of sound in the absence of an external source. Okay? It's often associated with hearing loss, like I said. So hearing loss as we age, and then is a thought to be a result of abnormal neural activity at some point or points in the auditory pathway. So I'm going to show you the auditory pathway here in a sec. But then this is incorrectly interpreted by the brain as an actual sound. So there's damage maybe in parts of the brain. Functionally, they're not getting good connections, and that leads to this feeling that there's an actual sound there. So neurostimulation therapies which interfere with some level of abnormal activity could be an important approach for treatment. For tinnitus, where the pathological neuronal activity might be associated with auditory or other areas of the brain, these interventions that we're going to talk about, electromagnetic, electrical, acoustic stimulation, so direct hearing stimulation, separately or together can be proposed as treatments. Neurostimulation therapies could modulate this neural activity and deliver a permanent reduction in tinnitus by driving the neuroplastic changes necessary to interrupt abnormal levels of this cortical activity, restore typical levels of activity. Okay, so basically in different areas of the brain, they're not oscillating well. The area there is not working as well. And so brain stimulation or non-invasive stimulation that activates these pathways can produce these neuroplastic changes to improve the tinnitus. So this can change an activity that should alter or interrupt the tinnitus, reduce or completely abolish. And then so here they're reviewing different therapies of electrical stimulation. Okay, so let's go to this picture. Okay, so this is the auditory pathway. And so when we hear something, what happens is our ear, or the auricle here, is going to pick up the sound and send it through the auditory canal. And it goes through the auditory canal and it hits the eardrum here, okay, or the tympanic membrane. And that is going to send this vibration of the eardrum that goes through these three bones, the malleus, the incus, and the stapes. These are the three smallest bones in your body that then push and do more oscillation on this window here called the round window. And then that signal is then going to change like the waves in this fluid in your ear that goes down and it spins all the way through the cochlea here. So this cochlea, if we stretch it out, it kind of has smaller hair cells here at the start, and then really tall hair cells here in the middle. And so we hear low-pitched sounds out here. Sorry, we hear high-pitched sounds out here. And then as we go in, we hear more low-pitched sounds. Okay, so this is all the inner ear. And generally, we don't have problems here that are causing tinnitus. Now, if we have hearing loss due to damage to hair cells in here, then that can lead to changes in the brain centrally, causing tinnitus. Okay, but hearing loss is separate from tinnitus, even though it's most commonly associated. Once we pick up the sound, it comes in through this vestibular cochlear nerve that comes into the brain, or the brain stem here. And from here, it's going to travel up bilaterally. So we mostly go, this coming from, let's say, the right ear is going to mostly go to the left side of the brain, but it does go bilateral. So it's going to go to the cochlear nucleus, the superior olivary nucleus, the inferior colliculus, the medial geniculate nucleus, and then it's going to end in the primary auditory area in the temporal lobe. Okay, and so this is just the pathway. The names don't matter too much, but the fact that there is a pathway from the lower brainstem through the brainstem and then into the cortex of the brain, there are areas that could be damaged or have poor processing there. If, for instance, that example of hearing loss, if we have a lack of hearing, a lack of stimulation from hair cells in this region, then we get lack of stimulation through these pathways. And then the brain starts to not necessarily die, but the cells are looking for more stimulation. And so they almost start stimulating themselves. And by stimulating themselves, it's a way to keep them alive, keep them active. And then that's what causes the tinnitus. And so we hear either a low pitch or a high pitch sound. That's what the tinnitus is. And so what we can do is we can stimulate either parts of the ear, or we can stimulate electrically maybe, or we can stimulate parts of the brain and the brain stem, or even the auditory center to help improve the tinnitus, basically decrease the tinnitus, improve the cellular functioning in these areas. And we can do that in a variety of ways. And so the first thing we're going to talk about is just these electrical stimulation from this paper. There's just a couple of them that we'll discuss. And so, for instance, non-invasive electrical stimulation of the ear. So we can put stimulation right on the ear, activate it, and that can maybe improve the tinnitus. It does vary, 7 to 82% of patients perceiving benefit, but there is a factor there. There's another group that said permanent tinnitus decreased from 88% in a group of electrical stimulation only, and 90% in a group with combined electrical stimulation and kinesiotherapy. Okay, so we can combine therapies to help with that as well. Okay, other areas that we can do. So a TENS unit, so transcutaneous electrical nerve stimulation can also be beneficial. Transcranial alternate current stimulation. So this, we can stimulate different brain areas, like specifically right on the side of that temporal lobe to help improve that. We can also use vagal nerve stimulation. And so vagal nerve stimulation, they looked at animal studies here. They looked at some human studies with implanted vagus nerve stimulation. But if you want to be least invasive, we have transcutaneous vagus nerve stimulation that can go right on the outside of the ear. We can activate the vagus nerve, which helps decrease inflammation, also helps increase tone and cellular viability in that brainstem region, which could be the problem that is disrupted. And then we have some other stimulations that are a little bit more invasive. So like chronic electrical. So basically they implant a electrical device right on that hearing nerve, the vestibular cochlear nerve. Another way is brain surface stimulation. Again, put stimulation right on that cortex. And then another one would be deep brain stimulation, I believe is the last one here. Right here, deep brain stimulation, which again can help with a variety of different neurological diseases, and they're proposing tinnitus is one of them. And so you can stimulate directly the parts of the brainstem. And all of these have been shown to improve tinnitus. But I want to go back here. And if we go back to this picture, we know that in functional neurology and in knowing the different areas of the brain and how they function together, we can determine which parts of the brain are not working as well. And then we can stimulate those areas to help to increase the viability, help increase blood flow to these areas, and then therefore improve overall connections, improve the functional capacity of those areas, and therefore decrease tinnitus. So we can do that by identifying specific eye movements related to these areas. We can do that by checking hearing, a vibration of different hertz, so different either high pitch or low pitch. And we can also identify this just by the different brain areas here by looking at facial tone, facial connection, tongue movement, palate elevation, a lot of things that are all related to this brainstem. And then obviously movement and motor control. So in conclusion, tinnitus is something that does affect a lot of people. That study that showed you there actually identified 16% of the American population has tinnitus. And it's something that people either just learn to live with, or it really bugs them enough because it affects their daily life. It may affect their job if they're in a musical field or a field that really requires them to use their hearing well. And so in that case, we can help. We can help to decrease those areas or decrease that tinnitus by improving the areas that are involved within the brain centrally. And so hope you guys enjoyed this one. It's something that it might be a little bit different. Many people don't maybe look for areas that they can improve for hearing loss and tinnitus, but it can be helpful. So if you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thank you and have a great day.